to move a patient from symptomology and subluxation to a path of optimized expression of health. And the patient we're going to be discussing this with today is Wilson. He is a 40-year-old former college athlete, surfer, beach bum extraordinaire who's been experiencing a lot of pain in his upper neck, some stiffness, decreased range of motion, accompanied with some eye pain when he has headaches. And this has really diminished his quality of life because he enjoys spending lots of time out and about, being physical, being active, and kind of being the life of the party. But since he's been experiencing these symptoms, he hasn't really been able to express that quality of life. So we're going to take you from our initial contact with the office through our reported findings, all the way through how we move this patient from a condition-based care into a conscious decision to hop on maintenance care and corrective care, and then becoming chiropractic is their lifestyle, so that they can express that optimal level of health and care. Hey Wilson, Dr. Gorman here. We're excited that you came into the practice today to address some of your health concerns. My CA, Jennifer, already went through some questions and some forms with you, and she informed me that the main reason why you sought treatment here is because you really wanted to deal with the symptom that you've been experiencing, that really tight neck in the upper right. You've been having eye headaches, and you've been having a hard time sleeping and just expressing the life that you normally live, being out and about, being physically active, engaging people dynamically, and with a lot of joy. So what we're going to do here is we're going to take you through our process where we do a case history, where we do an examination, and then we're going to do a report of findings so that you can make an informed decision about what you want to do to reach your healthcare goals. And then after that, what we'll do is we'll do a reassessment, a re-examination after 10 visits to see how we're doing with our progress to help you reach your health goals. So we want you to know that we want to provide you with the greatest, highest level of quality care that we can. We value you as a patient. We value your input into this process. We can't do it by ourselves. We need you to be active, and so we're going to present you with resources, materials, learning opportunities, and environments to help you make an informed decision to choose the best path for your healthcare. So, given that information and what my CA Jennifer shared with me about your attitude toward health, is that you don't want to just get that symptom treated. You really want to be expressing health as much as you can. So we want to help you do that, and in order to facilitate that, we need to take the next step. And the next step is for us to conduct an examination and come back and share that information with you about what we found in our examination, so that we can have a very detailed and informed plan of care to help you reach your healthcare goal of optimizing and expressing life to the fullest. Does that sound like something you'd like to continue with? Yes. Okay, Wilson, we did a thorough examination, reviewed your case history. There's a couple things that are probably contributing to your condition that you're experiencing that's diminishing the quality of life that you're normally used to. And one of the first things is you had a significant trauma as a child in a car accident around 6 years old. And that trauma is the source of what we call vertebral subluxation complex, which affects the muscle tone, the nervous system conduction, as well as just the alignment in your spine. So as you experience that trauma that created misalignments, and because you didn't get it checked out and addressed as a child, you've experienced some symptomology from that. And what we're going to show you today is how your body's reacted to that trauma, and then continuing to see in your case history you had additional traumas of, in high school you got hit in the head with a metal bar, and you reported that you didn't experience much range of motion for a long time after that. And then also when you were playing pickup basketball, you got set on a blind pick that really jacked up your neck. So you have 3 significant injuries, traumas to your upper neck area that have influenced how your body expresses health, because it's affected your alignment, it's affected your muscles, it's affected your nervous system conduction, and it's affected the alignment of your spine, and as well as just everything, vascular, your entire health. So we're going to show you about that. So as you can see here, you have a little bit of a head rotation off to the right a little bit. You got a little bit of a drooping shoulder here, and that posture creates a lot of tension on that area of the spine as it comes in here, and basically creates some nerve pressure and diminishes the ability for your nerves to send those signals, and it gets the muscles going crazy and intense, and just makes your body not respond and wants to continue to stay in that misaligned position that's making you experience this pain and discomfort. So our goal is to go ahead and set up this plan of attack, this treatment plan that's going to help you really get after this vertebral subluxation complex. And like we said, it's been multiple years in the making, so to speak. You had it at 6 years old in a car accident, high school, you got hit in the head, college, you had that pick set on you in a basketball pickup game. 3 major traumas, and then there's also micro traumas of stress, toxins, thoughts that just add up and build, and you've been experiencing some spasm in your upper traps when you experience stress, and that can be related to your misalignment. So we're going to help you express health. We're going to help you get realigned and hopefully bring back the optimized nervous system conduction from your brain down to all the nerves, cells, tissues, and organs in your body to help you experience function. So that's about it. So our recommendation for you, based on x-rays, is you're still in a phase 1 category of subluxation and spinal degeneration. So the good news about that is you should respond really well to care. And so we're excited about that, and what we're going to do is we're going to set up a plan for the next 9 visits to get after it, and then on the 10th visit we're going to go ahead and basically reassess and see from your chief complaints and see from the examination of the neuropathophysiology, the nerve conduction, through a muscle test. You had some muscle test weakness, you had decreased range of motion, you had some taut and tender fibers on palpation, and we're going to reassess all of that stuff that we did here first on our initial examination, and we're going to compare and contrast to see how much progress we're making. Okay, and then so basically you have really tight fibers on your right side of your neck, posterior and in front, and your histopathology looks pretty good on our x-rays. It doesn't really seem like it's anything that's really pathological. Like I said, phase 1 with the subluxation degeneration, and so you're in between near normal and phase 1, and like we said, you'll respond really well to care. And so we're going to show you on the x-rays here. You can see up here this x-ray. This is normal, and this is really bad, so phase 4, and this is phase 1, and you fall in between phase 1 and phase 2. Like I said, you respond to care, and can you see that? You can see that well? Excellent. So, and then your thoracics, all these other films that we took of your thoracics look pretty good. So we took a lateral and AP cervical, we took flexion extension views, and you just have a little bit of a misalignment in your occiput atlas joint. So that's the top bone of your skull resting on the top bone of the vertebrae of your spine, and we're going to fix that. And what's really cool about that is that's where your nervous system comes all into a point through your spinal cord, and everything from your brain to your spinal cord gets expressed out to your upper extremities, to all the systems, cells, tissues in the body, and we're going to get that going for you. So we're going to go ahead and let you go today. We're going to have you hang out with Jennifer, and she's going to explain our financial policies and procedures, and get you set up for your appointment for care, and then we're going to get you out of here. All right, Wilson, good to see you again today. I'm super excited about today, this re-examination, because we've made some serious progress. As I've palpated your neck fibers, they're not taut, they're not tender, there's no edema. As we've done the muscle test, you've gotten a lot stronger, and that's awesome. And your range of motion, when we've done the motion palpation, and then when we've done some static palpation, those things are looking really, really good. And what's even more exciting to me is the fact that you're having diminished symptoms, as you've told me over the last couple of days, last couple of visits, that you've been experiencing just basically a diminution of your symptoms where they don't even express themselves, and you've been experiencing joy, activity like you normally do when you're feeling healthy. So we're excited about that. And what we have to do now is your condition has basically, symptomology condition has been taken care of, but you know that chiropractic isn't just about removing symptoms. We want to help you express the optimal level of health by having your nervous system integrated, by maintaining your spinal column structure so that the function of the rest of your body can do a great job the way it was created to. And so today, we got two things we want to talk to you about. We want to talk to you about where we go from here. Are we going to continue care and continue to work on correcting the films where you saw a little bit of between phase 1 and normal, to try to really correct that and get that response from your structural and your alignment standpoint, and to optimize the expression of your nervous system. And then also we want to make sure that as you've experienced this health transformation, so to speak, with these powerful but simple, specific chiropractic adjustments, we want to ask you if there's anybody you know that you would like to share the message of chiropractic with, so that they can experience what you've experienced, going from pain, suffering, and symptomatology to experience and basically getting your life back, feeling good. So let's start with the referrals. Do you know anybody that you would like to refer? Okay. How do you think Joe would respond to a message of chiropractic best? Through email, through some brochures. I got some brochures here. Through a phone call. We have a dinner with the doc. Would you like to come to our healthcare class? And you did a great job of attending the healthcare class right away. That's awesome. You're being proactive about your health. You're doing everything we've asked you to, which is great. And okay, so you think that having him come to the healthcare class and some brochures would be great? All right, awesome. So we're gonna get those to you. Jennifer will make sure he gets contacted and signed up for the healthcare class, and then we'll get you those brochures. And then right now you have a choice. We can either finish care and be done with it, or we can go ahead and pursue that corrective care. And then as we get that correction going, we'll move into this pattern of health. You can see that there's multiple pathways of health here. We want to move you from just condition-based care to optimum health expression, wellness care, and get you make sure that you're fine-tuned all the time. And but to get to that full expression, we need to correct some of the things we said on X-ray that go deeper with all those traumas. Just because you're not experiencing the symptoms doesn't mean this is totally fixed. So we've done a great job of making progress, but we want to take care of this so that we can really get you from phase 1 back to normal. Sound good? So, oh, that's good. All right, awesome. Well, we're looking forward to you moving forward in your care with us, and Jennifer's going to hook you up with some more information about setting up an appointment and the path of care that I've given her for you for that. So, thank you very much. And here you can see my Dr. Riekman's Quest materials brochure. We got the intro to the office. We have the exam material. We have the case history material. We have the report of findings material through here. Obviously, there's things that you want to master in this, and the video is just a quick run through. Try to do it off the top of my head. Progressive report. Goal is to get them to have a 74% conversion, and then marketing. You want to do a great job of procedural marketing that's free with in-house, and we've got all this stuff here. And then I have at the very end all the material that was presented on Blackboard to really help you walk through that and listening to those videos. So I'm looking forward to getting into that a little bit more in depth. And then for the research binder, we have vertebral subluxation. We just have one article there for chiropractic spinal treatment. We have multiple articles here that we're just addressing. These are all peer-reviewed off of Google Scholar. So functional neurology and chiropractic. This subluxation-based care. And then I made my own subject here because my dad's a world-renowned sports chiropractor, and I'm going to follow in his footsteps in that arena. And so we just have some sports stuff on optimizing performance. And then we have the wellness care and preventative medicine. So let's see here. We got more. This binder's not very good. So, and then we got some just one example of bad medicine from the New England Journal of Medicine and people experiencing bad stuff in hospitals. So those are my research binders.